guys, welcome back to A to Z Dentistry, a channel which features easy explanation of various medical and dental related topics. And our today's topic is clinical and histological features of periodontal pocket. So without any further delay, let's get started. So in today's video, we'll be correlating the clinical findings with the histopathological findings in case of periodontal pocket, right? So in the first cloud, we are looking at the clinical findings, and at the cloud which is at the bottom, we are looking at the histopathological features of periodontal pocket, right? So now to begin with, the gingival wall of the pocket presents with various degrees of bluish red discoloration, flaccidity, a smooth shiny surface, and pitting on pressure. So in this diagram we can see, right, there is reddish discoloration of the gingival wall of the pocket, right? The clinician is showing that with the help of a probe, right? That is the pocket which is present over there. Okay, so now what is happening here? There is discoloration, right? Along with there is flaccidity. Flaccidity meaning there is lack of firmness of the gingiva here, right? Also there is a smooth shiny surface and there is pitting on pressure, right? So whenever we are checking the inflamed tissue, there is definitely a pitting on pressure which occurs due to edema and degeneration of the gingival fibers. Okay, so now we'll try to relate this clinical features with the histopathological findings. Okay, so as we have studied, there is a bluish red discoloration. Now this discoloration is because of the circulatory stagnation. Okay, the flaccidity or the lack of firmness is basically due to destruction of the gingival fibers as well as the surrounding tissues including the periodontium, right? The smooth and shiny surface, so here we can see there is a relatively smooth and shiny surface and there is loss of stippling, right? So this is basically because of the atrophy of epithelium and presence of inflammatory edema over there. Okay, now this edema is because of accumulation of large amount of leukocytes, dead and necrotic material, microbes, etc. Okay, and the pitting of pressure is due to edema and degeneration of the gingival fibers. Moving on further to our second clinical and histopathological feature. So the gingival wall of the periodontal pocket may be pink and firm, but this occurs in very rare and very few cases, right? So in the first slide we have studied that the gingival wall of the pocket is usually flaccided, it is not firm, but in a very minority of the cases we can see the wall is still firm. Okay, so why is this wall firm? So relating it with the histopathology, the fibrotic changes basically predominant in these cases. Okay, so there is very little amount of exudation and degeneration of the fibers. Instead, there is increase in the amount of fibrosis. So whenever a tissue is subjected to any attack by microorganism, for that matter, two types of changes are possible. One is the inflammatory one, which is the most common one, and in rare cases there might be fibrotic changes, right? So in cases of inflammatory changes, there is huge amount of leukocytes which are coming to that area in order to resolve the inflammation, and in cases of fibrotic changes, this occurs mostly in chronic cases. There is increase in the amount of fibrotic tissue, right? So in such cases, there is predominance of the fibrotic elements over the exudation and the degeneration of gingival fibers, right? And this is particularly in relation to the outer surface of the pocket wall. However, despite the external appearance of health, the inner wall of the pocket invariably presents with some degree of degeneration and it is often ulcerated, right? So the epithelium is often ulcerated. No matter clinically how it is seen, it might be firm, right, while palpation, but what happens is internally there is invariably amount of degeneration of the periodontal fibers as well as there is ulceration inside the pocket wall. Okay, so here in this case we can see, right, the wall is firm as compared to the previous case, but then again if you correlate it with the histopathological features, we can see there is a large amount of ulceration which is occurring and also there is large amount of fibroblasts which are seen, right? So because of the increase in the number of fibroblasts, there are fibrotic changes which are more predominant as compared to the inflammatory changes here. Moving on towards our third features. Okay, so clinically definitely there is bleeding on probing, right? So even if the tissues are slightly elucidated by means of gentle probing, right, there is bleeding almost spontaneously from the soft tissue wall of the pocket. Okay, now why is this bleeding occurring? Okay, now histopathologically what we can find is there is increased amount of vascularity. Okay, also there is thinning and degeneration of the overlying epithelium. Now because of this huge amount of leukocytes and microbial debris which are present, there is degeneration of the overlying epithelium. Now because of this degeneration of the epithelium, the engrossed vessels which are normally present within the connective tissue, right, the vessels are present within the connective tissue, and because the overlying epithelial level the epithelial lining is damaged, what is happening, these engrossed vessels are ultimately getting in close contact with the inner surface. Okay, and because of this there is ease of bleeding. So whenever you are touching your probe or putting your probe inside the pocket, the engrossed vessels are onto the surface, right? So whenever there is slightest amount of pressure, spontaneously there is oozing of blood from the pocket. So here you can see the clinician is using a probe to check the depth, and almost spontaneously there is bleeding occurring from the wall of the pocket, right? So this is one of the clinical finding, and histologically you can correlate here. You can see there are large amount of leukocytes which are there, right? And these are, there are RBCs which are very close to the surface of the epithelium. There is degradation of the overlying epithelium, and because of that whenever you are probing, almost like spontaneously there is oozing of the blood from the wall of the pocket. Moving on towards our fourth feature, right? So when explored with a probe, the inner aspect of the pocket is generally painful. Now as we have discussed previously, there is a huge amount of inflammatory reaction which is occurring inside the pocket wall, right? So whenever you are trying to probe with the help of a probe, there is a painful sensation to the patient. Okay, so here in this figure you can see this is the pocket, and also there is invariably a small amount of bone destruction. Okay, so whenever you are trying to probe with the help of a probe, right, the patient might experience some degree of pain. Okay, and histopathologically, pain on tactile stimulation is caused by ulceration of the inner aspect of the pocket wall. So there is ulceration because of thinning of the overlying epithelium. Okay, now because of this ulceration, whenever you are trying to probe, the patient usually complains of pain. Moving on towards our last features. So in many of the cases there is spontaneous exudation of the pus. So whenever by digital pressure you are trying to evaluate the pocket, there might be a spontaneous exudation of the pus from the periodontal pocket, right? So here you can see the clinician is using digital pressure, and there is exudation of the pus. Okay, in this molar region you can see this yellowish thing, that this yellowish exuded, it is nothing but the pus. Now this pus basically consists of dead and dying microorganisms, leukocytes, fibrin, right? So all these materials are exuded. Okay, so histologically, the pus occurs in pockets with suppurative inflammation of the inner wall, right? So we have studied that there is inflammation going on in the wall of the pocket, right? And there are suppurative changes, the degenerative changes, right? The epithelium is getting destroyed. There are RBCs which are getting destroyed. Okay, then there are microorganisms also which are dying. Okay, so all these dead and necrotic matter is exudated in the form of pus, and this pus is present because there is a suppurative inflammation which is occurring. So here you can see there are microorganisms, right? So these are basically seen because of the inflammatory changes which are present in the wall of the pocket. So guys, that was all about clinical features as well as histopathological features of periodontal pocket, right? So we have studied them simultaneously to look at the correlation between the clinical features with the histopathological features. I hope you understood the topic very well. If you like this video, kindly consider subscribing to my channel. Till then, this is Dr. Snehal signing off. Bye bye. Take care.